DevX coming back to you all once again with a conversation with a leader in our community. We've been doing a series of these. I'm really excited to have Winnie Byanyima, just somebody who I'm always delighted to see in person all over the world when we get a chance to meet. And so it's really great to get a chance to see you on video, at least today, Winnie. Winnie is the executive director of UNAIDS. Of course, before that, the longstanding executive director of Oxfam International, someone very well known in our community. And so there's so much we want to talk about. I want to get your take on the situation in general, Winnie, but maybe first we can just start. DevX has been reporting a lot on what will the pandemic mean for other global health disease areas and areas of focus, including HIV/AIDS, which you are leading the global coordination effort on at UNAIDS right now. So what are you seeing? What has this meant for UNAIDS work? What has it meant for the fight against HIV?
Thank you for having me, Raj. DevX is my favorite platform. You do such good globally on development issues. COVID is, coronavirus is really, it's a human crisis. It's not just a health crisis, as we've seen. It's having social and economic consequences, taking away livelihoods, and crushing economies worldwide. The virus doesn't discriminate, that we have seen, but its impacts do discriminate. It is the most vulnerable, the poorest, whom we are seeing being hit hardest. And so in our world of HIV/AIDS, we are talking about two colliding pandemics, the pandemic of coronavirus and the pandemic of HIV/AIDS. If you can see the devastation in rich countries, seeing Italy struggling with its rich health system, seeing America struggling, overstretched staff with no gowns, with no protective equipment in the rich countries, now hitting the developing countries like Africa already with a high burden of HIV, of TB, of malaria, and poverty, it is going to have devastating impacts there.
And is that your expectation, Winnie? Is that because there's a lot of debate about whether, maybe Africa will be spared, the numbers there won't rise that much. It's a very youthful population. Is your expectation that coronavirus, the COVID-19, will dramatically hit the countries of the global South in general over time?
We don't know yet. We are seeing indeed a different trajectory in Africa. It is not moving as exponentially as it has been moving in Europe and America, but there is no reason to imagine that it will stay like that. Climate is changing, colder weather coming in the South, and the virus itself keeps changing itself as it moves in every place. So we don't know. We just need to be prepared. And so far, yes, it's good. We see that countries, especially African countries, despite being very poor, have come together and done so much to prevent. But let me tell you, it's still, the virus has found a very unequal world with huge inequalities between countries and within countries. We are not prepared. Look, Africa would like to increase, to aggressively do testing. The head of Africa Center for Disease Control told me he would like to have 10 million tests done in the next 4 months. But Africa is at the back of the queue for test kits. Even those with money can't buy them. We're talking of a vaccine, $8 billion have been pledged, and that's great for development and distribution of a vaccine. But there's no formula out there, no guarantees that those who will hit the vaccine won't serve themselves first and have people dying in the South waiting in the queue. So we need to close these gaps of inequality. We need to be sure that we have a global public good in a vaccine. It's declared so, that licenses are given to different countries in different regions to produce and serve their people. So UNAIDS, we are working with civil society on a campaign for this. Not just vaccines, test kits, all diagnostics, all therapeutics for this virus. The right to health has never been more important, and the sense that you are not safe until we are all safe.
And sitting here in the United States, I can tell you, it doesn't feel like that narrative has captured our attention yet. It's still the narrative is still very local. It's about what's happening in our own community, our city, our state. And it's not yet the idea this is a global pandemic and what happens anywhere is going to affect the rest of the world. That hasn't seemed to have broken through yet. I don't know how you feel about it.
Yeah, this is the crisis in the multilateral system, that countries have over time lost faith in global solutions and are all looking inward. But like I said, there are still some progressive voices in a number of countries saying this is a global problem. We will not solve it by looking inward. As long as this virus is the one is out there, it doesn't respect borders. And we are in global, and trade is global. We must move, we must trade. So we must find solutions for everyone. And another thing, Raj, is that it's not a health issue, as I've said. A pandemic can't be addressed through a health approach. It is about the social structures in society. It's about how communities are empowered to fight on the ground. It's about the speed of scientific solutions. It's about politics and whose needs are prioritized. It's about laws and human rights. You can see, for example, around the world, these lockdown measures are crushing poor people. People are being made to choose between food, the right to not to starve, and public safety. How can that be a choice? That stay indoors to prevent corona, meanwhile starve? It's not a choice. Sex workers are being targeted in many countries, including Uganda. They are being told, you are the ones passing this virus around, victimized, targeted. So we need multi-sectoral global response to this crisis and put communities at the center so that they fight for their lives. Communities are important. And human rights, put human rights, no discrimination, no stigmatization. These things we've learned from HIV, and they are the ones which will work for coronavirus.
That's an important message. Let me ask you a little bit more about HIV specifically. You talked about test kits. What I'm hearing is that in many of the countries that have a high burden of HIV, it's the testing machines that are used for HIV that are being repurposed for coronavirus. Of course, there is the need to get swabs and other test kit material, but is that your understanding as well, that the infrastructure that's been built over the years to address HIV, some of that is going to be repurposed for the fight against the coronavirus?
Absolutely. You see, we have a new pandemic, but every pandemic won't always have its own new different things to deal with it. Countries use what exists. And indeed, the labs which are already there for HIV are being repurposed for coronavirus. The people, the human resource, the people who were trained to fight a pandemic, HIV, are also in the response for the coronavirus. The community volunteers, the community health workers on the ground are using all the skills they learned for testing, to support testing in communities, to support contact tracing. So it is the same machinery being repurposed to help with this, but it's so important that it doesn't drop the ball on HIV, because HIV has gone away. HIV hasn't gone away. So we are watching to see that across supply chains, down in communities, in scientific labs, that as we use this machinery to support fighting this deadly pandemic, we remember that there's another one and it's also served. So for example, we're looking at manufacturers, those who produce the commodities for prevention and for treating HIV, those who produce condoms, those who produce ARVs. We want to be sure that they are not going to fall for the demand for new commodities and switch from producing. A condom might have a smaller profit than a mask today. So we can't have those who produce condoms switching to masks, and then we increase infections because there are no condoms. So
but realistically, we are going to see some of this impact, right? I mean, realistically, we've been reporting on this for many of the infectious diseases like HIV. It's hard to imagine when you think of the fact that it's more dangerous than before to go to a clinic and to get access to your medicine and to be around others, and the lockdown orders, of course, might even increase stigmatization. If people are leaving, they wonder, why are you leaving to get your medicine? Test kits, home self-testing is a great idea, but it's not everywhere. I mean, aren't we likely to see some real negative result on the goals, on the progress toward the HIV goals?
We are seeing some. And we are about to come out with a model with some of our partners, modeling what are the likely impacts on HIV services as services are diverted towards fighting another epidemic. We need to know this and guard against it. So we'll be coming out with some concrete analysis. However, we are seeing it already. We're seeing some of the most inspiring stories have been about how people living with HIV and the communities that are affected by HIV are going out to help each other in this context of lockdowns, where people are unable to reach their clinics. We are advising that there should be multi-month dispensing of ARVs, but where it isn't happening, you're seeing poor men on bicycles collecting medicines for 4, 5, 10 other people in the village and taking it around. These are heroic stories, but we are watching that, and we are seeing indeed that people living with HIV we do quick surveys in various countries, and we see real problems. We try to solve them, but it's bigger than that. It really needs careful planning for two colliding pandemics where we have a high burden of HIV.
UNAIDS has these well-known 90-90-90 targets that aim to be reached by 2020. I wonder whether those targets or any others you might have to delay, like change the date and say we are now shooting for 2021 instead of 2020. How do you see that? What are you seeing in terms of the progress against the metrics that you use to judge our success?
We don't need to go that way. It is likely to happen, indeed, if we fight this epidemic without taking care of other diseases that are wiping people out. Look, in our last report, in our UNAIDS report, we showed that 1.7 new infections. There was 1.7 million new infections in 2018. There were 770,000 people who died in 2018. So far, in 4 months or so, this epidemic has already taken more than 260,000 lives. By the end of the year, it could be 1 million. So it will be killing to the same extent as HIV, you see? So we have to be able to support the developing countries with this high burden of HIV to fight on two fronts. And this is where I'm seeing the global solidarity isn't coming through strong enough. There is now some alignment on a vaccine, good. But even there, like I said, we don't have a full agreement that we will all get it equally at the same time without putting profit before our lives. That is there. But now, even with test kits, with labs, with the contact tracing, we're seeing some debt being deferred.
And with PPE, with masks and the rest, yeah, there's a similar issue.
The cost is high. We've found Africa, do you know, Raj, that 30 countries in Africa today are putting more money towards debt repayments than in their health budgets. So now debt has been deferred for a few months. But we're going to be with this situation well beyond 6 months. So we need more support for the developing countries to fight on these two fronts. And I'm not seeing that happening yet. So the call for global solidarity couldn't be more important than now. And that's why I value platforms like yours.
Thank you. Well, one issue I have not seen definitive information on, I'm curious if you have any at UNAIDS or if you have a sense, are people living with HIV at greater risk for the coronavirus effects? Is there more danger for them if they get the coronavirus? Do we know that at this point?
No, we don't. The scientists are still out there trying to piece it together. But what we know is enough for us to put people living with HIV on alert, because we know, for example, about comorbidities, that if you have chest infections or have suffered them and have weakened your chest, if you have diabetes, if you are hypertensive, certain diseases, some of them are very common amongst people living with HIV. Then we also know that there are at least 15 million people living with HIV, but who have not yet come on treatment, who have not tested. Now, that number of people could have depressed immunity. The depressed immunity may have gotten them to have opportunistic infections like TB and others. That puts them in a high risk category. So our message is, if you've not tested and suspect you could be, this is the time to test. If you've tested and you're not on treatment, get on treatment, have your treatment so that you avoid opportunistic infections, which could then lead to you being more vulnerable to corona. But we don't know the link there, and we are still waiting for the evidence to come.
Some people are saying self-testing is going to be more important now than ever because of the lockdowns related to the coronavirus. How do you see the current potential around self-testing? What's the status at this point?
Absolutely. Self-testing is going to become more important. There were some questions about its value, but now in this context, you do need it. I would argue that you need self-testing, but also we must get more services delivered digitally. For example, counseling services. These counseling services can happen digitally. And we're not seeing a lot of that going on, because when you get a test result, you need to be counseled, you need to be led on to what to do next with your life. That has to come together with the test.
Maybe we can switch gears a little. I'm just curious, you're leading this big UN agency, UNAIDS, and this is a big shift for everyone to figure out how to work during a period of lockdown. UN people like yourself are used to traveling all over the world. We can't travel now. I think you're in Geneva at the moment where your headquarters are. What has it been like to lead a UN agency in this new moment? And what do you think some of the long-term effects are going to be?
Well, it's interesting you ask me that question because, as you know, Raj, I was leading a global network, Oxfam. And Oxfam was much more a virtual organization than where I am today. I was leading with my team spread around the world and working mostly virtually with my top team. Now, to get my UNAIDS small organization to start working digitally, I saw how much it was shocking for most people, and literally have had to work with my team to spend more time on duty of care, listening to staff who just cannot cope sitting isolated at home, who need the affirmation of their team at the office, and bringing in our well-being officer to give a lot of pep talking and support to people who are not used to a workplace of isolation. But I was more used to it. I kind of have managed to sit here at home and work. But yeah, it's been quite challenging. But the travel bit, I don't regret.
Yeah,
I'm just seeing that it is possible to work a lot virtually and do less travel. And I hope when we come back, we will keep some of these elements of virtual working and less travel. I certainly feel good to have been on the ground for 2 months so far without sitting on a plane.
I feel the same way. It's an unusual feeling, and it's a good one to be home and not traveling so much, and better for the environment too, for us to not be on planes.
Absolutely.
Yeah, but this is an industry, you've been in it a long time, the aid and development philanthropic industry, that travel and conferences is a big part of how we work. When you want to get something through, like, a new set of targets for HIV or new funding, so much of it is going to capitals and meeting with parliamentarians and meeting with ministers and twisting arms. How do you think that's going to work in this environment?
You see, I think a lot of what we have been doing, achieving face-to-face, we can achieve virtually. we just need to perhaps change the pace at which we do things. Certainly, virtual working would make us work at a slower pace in terms of building consensus and so on. But I think that the real crisis for us to address is the crisis of multilateralism. Because multilateralism isn't failing because today, because we cannot move and meet and talk. It was already failing. We can't solve global problems. We are all the time either unable completely, countries going off, look at climate change. We failed to solve that. We have a Paris Agreement, but it is weak in many parts. And instead of having commitments on emission targets, we have targets set by each country according to what they want to do. And there isn't even enough monitoring to ensure that they deliver what they've promised. That's the weakness. Look at how we deal with inequality. Inequality is just widening. And with such inequalities, you can't have global solutions. We are unable to solve the issue of tax justice. So for me, the big issue is for the world to wake up to the need, like there was at the end of the Second World War, for global solutions through global approaches, through a reformed UN system. Otherwise, I don't think working, but are understanding that we have to solve problems together and share power in a space and reach good solutions. Look at the war between the US and China, the war of words. China has reached a point where it is seen as the problem, but it isn't. What is the problem is that the system, the global governance system, doesn't give space for countries that have emerged, such as China, India, Brazil, and others. And so the system is clogged. So you see these two countries fighting it out outside the system. But in fact, it's the system we must reform so that everybody has a space to shape global solutions. That's the way I see it. That's where the problem lies.
In some ways, this crisis presents an opportunity when you have governments like the US suddenly pushing out huge amounts of fiscal stimulus, trillions of dollars. You would think this could be a moment when maybe a large package, we have PEPFAR, the largest global health program in the world, funded by the US government under a Republican president, billions of dollars. Could we fund something similar for primary health or for health systems around the world, given a crisis like this? Yet we're not really seeing ambitious proposals. The numbers are relatively low. Maybe the most ambitious I heard this week was I had a similar conversation with Mark Lowcock a couple of days ago as the UN's humanitarian chief, and Mark is calling for a $90 billion investment in essential needs for people, food and medicine around the world from a humanitarian perspective. But in general, I feel like even from the development community itself, even from your former colleagues in the NGO world, we're not yet hearing very big, very bold programs. How do you feel about that at this point? Do you agree with that? And what would you like to see?
No, I'm disappointed. And I keep going back to this issue of global solidarity lacking, that in some countries, coronavirus now means that people are on the verge of starvation. But not only that, as I'm talking now, in my own country, in Uganda, the heavy rains have demolished hospitals. The hospital in Kasese near Congo has been broken down. Services are not there, health services for people. So they're dealing with climate change, there's real impacts. At the same time, trying to prevent a new virus. At the same time, an HIV virus is among them. And we don't see the global solidarity here. So for me, Raj, what has happened in the world has happened over a long time. Progressive forces sat back and forces that are for profit, for personal interest have taken over. There's a need for a new assertion. And I think we are at a moment like the end of the Second World War, where the devastation is so huge and is across the world. This can't gain us the momentum towards a system that guarantees the values we share of peace, of prosperity, of justice for all. If we can't come around those values now, I don't know when it will happen. This is the time, because, hey, even if you're selfish and you are the richest country on earth and you're only worried about your people, you know that your business is, you're getting your clothes from Bangladesh. That's where the manufacturing is. You will need at some point to travel there to see your factory. You know that your food is coming from a garden in Guatemala. You need to connect. It beats logic that you must care about the risks that come from poverty.
And a lot of the epidemiologists are saying that this disease is likely to go to the global south, go to the low-income countries, and then you might have a second wave that comes back, maybe with mutation, which is possible. Certainly, what happened in the 1918 Spanish flu. So even just from a pure global health security, national security standpoint, a non-humanitarian standpoint, there are good reasons to have global solidarity, as you described, but it does seem at this point to be lacking.
It's lacking that sense, let's secure the world. Let's secure the world from even an enlightened self-interest perspective. Even that is lacking. But there is work for progressive forces. I think that, should I switch my...
I think you're fine. We hear you okay. And we just have a minute or two left. In fact, before we close, I just wanted to find out from you, what should we expect from you, from UNAIDS looking forward as you battle, as you say, these two epidemics at the same time that are in many ways related, will impact a lot of the same people.
Yes.
What should we expect? You're saying we're not going to change targets.
No,
you're going to fight for resources. What should we be looking out for, those of us who are very concerned about the HIV situation and all the people living with HIV around the world? What should we be paying attention to at this point?
One, continue and build a strong momentum around the right to health, and that right to health is for all people and should be publicly financed for all people, with options for rich people to pay for themselves, of course. So that is an important assertion we must make. Then secondly, that health systems must be about being prepared and having primary healthcare prevention as an important pillar of health systems, plus preparedness for pandemics. So a health system that is more holistic than we have now, and that is providing health free at the point of delivery, is something we have to fight for. Third, now for us here with our mandate, it is to get all the support we can to bring attention to two pandemics, so that there is no going back on HIV as we fight one, but that we fight both. And there are opportunities really for finding synergies between the two and sharing resources and learnings. So we need to keep going on that. So I'm looking for more support for the work we do to defend the services and the rights of people living with HIV and communities affected. But I'm also engaging on the bigger question of, what have we learned about the right to health? How are we going to finance it in the future?
You're so right. Those are linked, and it's a really powerful and important message. Thank you for sharing it with us. It's really wonderful to see you, Winnie, as always. Thank you for the good work you and your colleagues are doing at UNAIDS.
Thank you, Raj, for your work too, and for taking our voices and amplifying them.
Great to see you.